The many experiences that have been relayed to our researchers over and over again suggest that we together have a lot of work to do if we want to move from good to great as far as the healthcare system is concerned. As I traveled this province from community to community across the province, the issue of access repeatedly emerged as an urgent and vivid concern. When patients' lives are put on hold due to long waiting periods to see a physician, or waiting to be scheduled for tests, or while waiting in the queue for surgery, often after many months, this is the time that is never recaptured in people's lives. Often, and again, you're aware, the consequences are huge. They're life-altering. There's loss of income involved in many instances, time lost with family, loss of participation in community life. Relationships are strained by anxiety, worry, and plan. Many of these patients are your colleagues, your neighbors, members of the family, and indeed, they may be your friends. I regard meaningful, visible improvements to access as mission critical. And I'm going to be providing my best advice on this complex and elusive issue to the Minister in my report this summer. The passing of time, a lot of time, has put a strain and put a lot of pressure on the system. Let me throw out a couple of examples. When patients have no choice but to default to the emergency rooms during an unexpected health episode and wait for 4, 5, 7 hours because there are no alternatives, especially in rural Saskatchewan. When patients get lost or they're orphaned during transitions between various care providers or between and among health regions. When rural residents make a long trip to access health care only to encounter expensive duplication and delay. When vital health information is not available or incomplete or not shared among care providers. When the elderly get bounced around with no one to coordinate or quarterback their care, and when families cannot find a family physician in their community, when patients, including First Nations and Métis citizens, encounter what we heard were dismissive, uncaring behavior from some staff, and in turn, the healthcare providers tell us that they have witnessed such behaviors in the workplace from their colleagues. That is when collectively, and no one has a monopoly on this, collectively we are letting down the very people that the healthcare system is committed to looking after. After all, in my view, they are the real shareholders of the healthcare enterprise. So you can come to the conclusion that over time, the public's confidence is shaken when they see core promises that were at the heart of Medicare not being delivered in the very province that gave birth to what has become, as we all know, a cherished Canadian legacy. So if we are to respond to the urgency in those patient voices, then I think there is a collective call to action that is needed. We must take action to protect the best and try together to fix the rest. People continually ask me how I will approach my task in writing my report. No one should expect me to spend a lot of time looking in the rearview mirror and criticize the players of the past, because to me that will have no value. To me, the past is just history. Rather, what I would like to do is utilize my time to offer a roadmap of urgent improvements that are forward-thinking, transformative, and will address key patient issues so that we can begin to restore confidence in the people. It's got to be nothing less than a team effort, including the minister, including his advisors, including healthcare professionals and leaders, including stakeholders, elected officials at every level, the public, and yes, for sure, your hospital foundation. If we are serious about creating healthier communities. So let me emphasize the number one concern of citizens. If there is one indicator that Saskatchewan people link to how the healthcare system is performing, it is indeed timely access to care. I believe, and I'm sure others in this room do as well, that wait times is simply a barometer by which citizens perceive how well or how badly the system is performing. And to me, being on a wait list for 6 months, for 7 months, we heard 18 months, we heard 20 months. To me, being on that wait list is not access to care. One promising option, and it's only one, and one can speculate around this. One promising way is to fix things, is to embrace the huge need for some innovative redesign of the care delivery model for many high-volume procedures based on very successful and proven leading practices and protocols. If we continue to do the same things the same way, I don't think we should expect better clinical results or higher patient satisfactions. Rather, I think we need a delivery model that will have the potential to decongest expensive hospital infrastructure, unclog those busy emergency rooms, provide care closer to home at every turn, and offer a more convenient access point for patients in need of diagnostics, in need of treatment, in need of education. In other words, making or arriving at a preferred destination point for healthcare that is incorporated in the very fabric of the community and not dependent on a hospital postal code. Now, such a model concept would be in keeping with putting the patient first. My focus will be over the next 3 months to develop a very compelling case for the minister, compelling case for change, to challenge the leadership and providers to hear the pleas of patients and encourage the adoption of leading care practices so that you together can provide and receive exceptional patient care in this province. So let me offer only a hypothetical pretend type of example of what I mean by innovation and transformation. And an example of how this could look like in your proud community of Regina. Imagine if the collective wisdom of the leadership in this city, in collaboration with the foundation and other partners, come together to make available diagnostics, screening, day surgery, ambulatory clinics, therapies, chronic disease assessment and monitoring clinics, designed with a focus on the patient under one umbrella in the heart of this great community.